Okay, so I want to talk to you a little bit about osteotomy, and this is something myself and Kristian, it's what really brought us together. I was doing live surgery, demonstrating all inside ACL. It was the second time it had been seen in Germany in 2010, and it was at Kristian's boss's course. Philip Lobenhofer ran a live surgery course. We came together, and we've been working in osteotomy, developing things like the care retractor, and developing techniques together since then. And what osteotomy is all about is preserving the knee. And you can see I was in Warsaw actually at a friend's meeting. I saw this guy doing some beautiful roller skating. He's not 20 years of age, and people are very active till very late. And we can see this spectrum of disease as the knee gets arthritic, and we want to keep people in the green. So we want to be doing preservation procedures before we do joint replacements or the salvage stuff. And that's what osteotomy is all about. Now, knee arthritis, the Holy Grail was thought to be a total knee replacement. And we believe in these, and we believe in partial knees on the inside, on the outside. We get patients sometimes where we do both. But we know from national joint statistics for total knee replacement, this was published in 2017, this is 65,000 patients with a minimum of 10 years follow-up. So they had to have had 10 years before they did the scores. And what they found was in the under 55s, 35% fail within 7 years. Mean time to have it redone, 4 years. It's a disaster. So in certain countries, you need 2 consultants to sign off before you can do a knee replacement in someone of that age, because it's just such bad news. Now, we believe in knee replacements. This is Mark, he's a physiotherapist. This is his partial knee replacement. And this is him walking on the day of surgery. He's done brilliantly. He got back to playing rugby. We believe in it. This gentleman here, he's a farmer. He'd actually had osteotomy surgery. He's 55. We did both of his knees at the same time. This is him a few hours after surgery, and he's moving his knees comfortably. He's not in too much pain. He's happy. And he went on to actually shoot this lovely testimonial of him driving and being active. This is him at
probably early 40s, and I've got progressively worse. I played a lot of sport, clearly being a farmer with a lot of life in Wellington Hospital. I was literally back on my feet day one, albeit on a Zimmer frame.
So we can get a great result with total knees. This gentleman here, day of partial knee replacement, and this gentleman here is absolutely fantastic. He came to us.
Yeah. Well, 2 weeks after his revision knee replacement.
So that's a revision knee replacement, 2 weeks. This is easier than the partial knee.
That's amazing, isn't it? Do you want me to do an Irish jig?
Do you want me to do an Irish jig? Anyway, great guy. So what is an osteotomy? And this is quite a nice animation that we can go through, which shows a weight-bearing line on the inside of the knee, which is most people are varus, so the weight bearing's on the inside, as opposed to being knock-kneed, where the weight bearing would be on the outside. There's disease on the inside. And in here, this case here, we can see significant arthritic change on both sides. And in grade 4, which makes up 35% of our cases, we can perform this operation in appropriate patients. And what we're aiming to do is to move the weight-bearing line from the inside to the middle of the knee. That's what an osteotomy is. And it can be done either in the femur or the tibia by either opening a wedge or closing a wedge in the tibia or the femur. Everybody has a long leg x-ray calibrated, and then we work out whether they're suitable for this surgery by doing virtual surgery before we then go to execute the osteotomy. We make, through a very small incision now, a minimally invasive approach to cut the bone and open. We pack that with borrowed bone and put the plate on, and that's an osteotomy. Now, we've set up a centre of excellence with Ronald Van Heervaarden, who you see here as part of this scientific advisory group, and we've taken Nuclip, which is the leading company now in osteotomy surgery, from being not very well known to being number one. And our plate, which we helped to design, is the most commonly used plate globally. So what about survivorship? This is my series. So I had a large grant, £500,000, to follow patients in Basingstoke, and I made it my, I suppose, my hobby from 2006, and collected these patients. And what we found was that at 10 years, 92% are doing well. We won the best consensus when we set the consensus document in Europe with Matt Olivier and here Matt Dawson, my good friends, and we won the best consensus in Paris for telling surgeons when, where, and what. Here's some pictures of rudimentary surgery, and now we have these sophisticated techniques. Look at this gentleman. He's 39, couldn't do any activities of daily living. This is him at a year after his osteotomy surgery, and he's walking, and in fact he's running 30 kilometers a week now, having not really been able to walk prior to the surgery. So these are the plates that we've designed. This one actually is my design. This is the most commonly used plate, the type 2 active motion plate. And we have a different plate for a different solution now, which we've helped to develop with this company. And we're very proud of this, the Care retractor, which is a specially designed retractor that can slip in behind the bone. It has a slot that receives the saw to make it very safe. And this is to stop surgeons from cutting the nerve, the vein, the artery at the back of the knee. It locks into place. It's been very well received by the orthopedic community, and we're very proud of that design and of that particular innovation. This is myself and Kristian messing around on another concept that we came up with, which is the hinge screw, which we can place at the hinge and open, and without breaking the hinge. Here, I'm sorry if that's a bit gruesome, but we can see a massive opening which we can achieve by stabilizing. Here we can see a hinge screw patient, and this gentleman has had a femoral osteotomy, and this is him 24 hours, less than 24 hours after surgery, the day after surgery, walking quite comfortably, having had his femoral osteotomy surgery. So I'll just play that a little bit, and then on to this gentleman who's back now doing taekwondo.
Yes, here we are. It's not quite 24 hours since we did surgery. We've done an osteotomy. We've got a nice straight leg here, and that was done relatively late yesterday afternoon. How are you feeling? How much pain are you in? No pain at all. Does that surprise you given that you straightened out your leg? Yes. Yeah.
So no pain at all, and actually got back to martial arts. Sorry, this is the same gentleman showing the preoperative x-rays in that gentleman, 38, pain with activities of daily living, no sports possible. That's the before, and then we saw the after. These are surgeons that we've operated on. Mark, a good friend from South Africa, doing the little bit of shimmying after his osteotomy under our care. Zayed came to us. He's the most senior sports medicine surgeon in the Middle East, from Jordan. And actually not our case here, but Anant Joshi, the father of knee surgery in India, who had this performed as live surgery 20 years ago, showing that it's the surgeon's choice. So does it last? This is Ronald, a bit younger, with his professor, Professor Marty, and this was a 20-year follow-up clinic where patients came up to say farewell and to tell Ronald and Professor Marty how good they're doing. So Ronald, much younger, me much younger, back in 2006, we visited with Neil Thomas, and we set up our masterclass in Basingstoke, which we ran in the north, and then we ran in London. And we've moved this all around the world, training and teaching. And as I say, we've followed our patients. So 651 high tibia osteotomies, followed very carefully. And what we found is 97% at 5 years, 91% of these patients doing well at 10 years. That's the largest series in the world for HTO. We then did via a PhD, and this was done by James, who very kindly did this PhD for me, showing fantastic return to activity after osteotomy surgery, which really does outperform partial knee replacement on many different levels, as shown recently from this data from Australia. This, again, the largest series for femoral osteotomy, 89% survivorship at 10 years. How good is osteotomy? Let's look at some cases. So this is a chap that came to us. He's 58. He's an ex-professional, semi-professional, run a long distance, best 5K time, 15 minutes. In 2021, was still running, but getting night pain, starting to really struggle. And when we look, absolutely nothing on the inside of his knee, bone on bone arthritis. He wants to run again. So here we are at 9 months. He's running 35 miles a week. He's biking. He wants to get a 6-minute pace after his osteotomy surgery. And he sends us this lovely picture of his first place. So he was at 80 degrees in Florida. First race, he did it in 22 minutes. He came first for the over 50s, fourth out of 250 on his bilateral osteotomies. This lady is This lady's just showing that this works in elderly people. This is about active people, not about age. Professor Takeuchi did a brilliant study, over 70, under 70. In fact, the over 70s did better. So what about if we've got someone who's got normal anatomy? So take this lady here. She's an ex-model. She's a very active lady. She fractured a tibia and it was fixed. And the slope here is going in the wrong direction. It's going uphill instead of downhill. She can't walk. She's literally confined to a wheelchair. And she came to us. She had a slope changing osteotomy to normalize the slope. She got out of her wheelchair. She's a very, very motivated person, and then got back to very high levels of activity. And we can see during this little snippet, she's working out, she's working hard on her bike, but she wanted to do more. So she actually started to, over the course of 12 months, get back to a totally normal level of activity, even doing quite extreme climbing. This young girl here, now look, she's 17, 5 years on crutches, since 12 years of age, 3 opinions. She finally gets to see Ronald Van Heervaarden. Watch her walk. So when she walks, she's kneeing in. And the problem is most doctors aren't trained to assess this. And the problem is not at the knee. The problem is in her shin bone. So Ronald did the assessment, which found that her foot was externally rotated. This is a 40-minute operation. And this is her walking at 3 months, completely normally, totally transformed her life. Ronald only does osteotomy, and he's performing 10 of these sorts of cases every single week. And we're very, very lucky to have him come and work with us as part of the London Osteotomy Centre. So what would you want? So here's a lady, bone-on-bone arthritis, both sides. So let's look at the case. 59, in 95 ligament surgery in New York. Then she has bilateral HTOs under our care, the right in 2003, the left in 2004. Then she comes back in 2015. She has a partial knee on one side and a total knee on the other. And this is her walking in Neil Thomas's office just prior to him retiring.
Just walk back. So just walk towards me.
Just kill the volume again. And she had both the hardware removed. She had this done as a simultaneous procedure. Obviously doing very well. What about if we overcorrect? So here's a difficult case, and here we've actually gone in and we've done a partial knee with an osteotomy. How many knees can we save? Every 10 seconds, somebody in the world is having a knee replacement, and 1/3 of them are suitable for osteotomy. So think about it. This is actually an interesting little video. These are hip patients, but the chap at the back has had a double level osteotomy. So he's had femoral and tibial corrections, and this is him hobbling slightly the day after his surgery. So we have lots of fellows and visitors, and we see Ronald here in the middle. We're very proud of the teaching that we do. This is a WhatsApp group that I set up. It has 115 members in it, mainly experts, all sharing cases and asking, what would you do with this and what would you do with that? And videos are sent in and cases are sent in, and we look and we talk and we chat and we plan. I'm very proud of that actually as a thing that I set up. So if you're interested, come and see us operating together, generally at the Cromwell Hospital. We'd love to see you. We're very proud of our centre, and there are my details if you want to email me, or if you have a problem you think you might be suitable for an osteotomy, get in touch.